So we're here at Synergy Sheffield Mental Health Alliance branding launch, and it's the accumulation of months worth of working group meetings, developing the logo and the relaunch of our name, because originally we were known as Sheffield Mental Health Alliance, but because of our alliance members, so Experts by Experience and the voluntary sector organisations that are involved, we got together, we asked alliance members what they wanted to be known as, and also developing kind of like what we want to represent to the community in Sheffield and wider as to how we look and what we do and what our aims are.
As you mentioned, today is the launching.
Yes.
What will you say is the main aim, and where did the idea come from?
The main aim of the launch.
The main aim of Synergy.
Oh, okay. So the main aim is we work together as a collective. So a collective of voluntary sector organisations, people with lived experience of mental illness, and we work together. We've come together. There's over 100 organisations currently in the Synergy Mental Health Alliance, and our main aim is to help support people with mental illness in Sheffield, to influence and to work with statutory organisations like the NHS and local authority in both shaping kind of what mental health services look like for people, but also in the way that they're delivered. So people who are accessing the services and who are delivering services in the community, and we've got a really rich, diverse community in Sheffield, exactly what that needs to be for each of those communities, because it's going to look very different from one side of Sheffield to the other, from one person to another, exactly what they need. But essentially we're hoping that we've got a no wrong door kind of approach. So wherever you are with your mental health, if you need support, you can access support, whether that's through a voluntary sector organisation as part of Synergy Alliance, or whether it's through statutory services.
I was listening to your speech earlier and listening to each and everyone during the presentation. My understanding is that the main aim here is like to make sure organisations work together, like you said, but also to put service users or people that need the support at the forefront. And I was listening to this Expert by Experience.
Yes.
You know, what will you say to those other people like who are not here today, you know, who are kind of like skeptical about the health inequalities in Sheffield, about what the voluntary sector or the NHS is doing? Because sometimes people hear about these alliances or about organizations, but then ordinary people just think like, look, it's the same old thing, you know, the health inequality will still continue. They're just there, you know, talking to us differently, but doing a different action.
Really good question. How do you deal with health inequalities? And I guess what I would say to the people at home who are sat there going, I'm struggling, and how is this alliance? What is this going to do? How is it going to be any different? What I would say is that we have people with lived experience as part of our alliance, and I would welcome anybody who's not been part of our alliance so far but who's interested in helping to shape and form and give their experience, to share their experience of what it's been like living with mental illness or accessing services, and any challenges or anything that's worked really well, to come and speak to us as a team, to speak to Sarah and Sam and Jess, who are part of the team that are helping support the Alliance, because actually it's not until you've got people who have got that lived experience as part of what and at the heart of what you do that things are going to change for the better, because actually it's about power and power imbalance as well when we're talking about health inequalities, and making sure that the services are listening directly to the people who need that support. So I would say to anybody at home, anybody not sure about what's going on or how they can be involved, or if they need some support, to come to come and approach us and to get in touch with the team, and we can talk you through whether that's working as an expert by experience within the team, or if it's that you need some support and you're not sure where to go, then please by all means contact us.